My name is Pell, and this is my evidence-based practice project for NSG 348 at the University of Buffalo School of Nursing. The purpose of this project is to decrease the use of opioid pain management in hospitalized post-operative patients on the orthopedic surgical trauma unit at Atlanta Medical Center, AMC, by increasing non-pharmacological interventions such as music therapy and guided imagery. Currently at AMC, there is no non-pharmacological interventions to improve pain. Patients are relying on multimodal protocol pain management and opioid pain medication regimens. The patient population are orthopedic trauma patients that endured a trauma-related injury from gunshot wounds, stab wounds, and motor vehicle accident injuries, etc. Patients are constantly in pain and are often requesting pain medication when it is not available to them, due to the frequency being only every 4 hours to every 6 hours. This information is what inspired me to conduct research on non-pharmacological interventions. My evidence search process started with one database, and due to lack of related articles, I expanded to 2 databases. Cumulative Index to Nursing and Allied Health Literature, CINHAL, and Midline. I use keywords for both Midline and CNAHL, music therapy and pain, guided imagery and pain. A lot of research is focused on a particular group of patients, such as sickle cell or cancer patients. My information is geared towards surgical patients. When I inputted music therapy and pain in CINHL, I retrieved 145 articles. I used 1. For music therapy and pain, for the Midline database, I retrieved 242 articles and retrieved 1. Well, used 1, For guided imagery and pain, on the CINAHL database, I retrieved 171 articles and used 2. In total, I used 4 articles for this project. The clinical question is, will the implementation of non-pharmacological interventions improve pain management in patients with post-operative and trauma-related injuries than only using opioid prescription drugs? The patient population for the PICO, post-operative patients, and patients with trauma-related injuries. Implementing non-pharmacological interventions such as music therapy and guided imagery to improve pain management and decrease the use of opioids. Comparison. The comparison would be patients who are receiving non-pharmacological interventions versus those who are not. The outcome is to improve pain management with non-pharmacological interventions and decrease the use of opioids while hospitalized. Implementation of practice. To implement change, you have to be aware of the 8 phases of change motto by Cotter. Creating sense of urgency, forming a guiding coalition, creating a vision, communicating the vision, empowering others to act on the vision, creating quick wins, build on change, and institutionalizing the change. There is not enough evidence to support a change in practice, but the evidence does display a positive direction and correlation between non-pharmacological coping strategies for pain management, anxiety, and depression. A pilot program would be appropriate to determine if Atlanta Medical's patients population would benefit from a research study implementing non-pharmacological interventions. Currently, the facility is not using any non-pharmacological interventions to improve pain. The plan is to use already set up televisions and computers that are built into each room. Each room is a private room. We would, as nurses, set the computer or the TV to music channels which are already provided, or guided imagery YouTube channels for patients who are being transported to the unit from PACU, ICU, or ED. To measure our success, we would use the numeric scale to assess pain scale every 4 hours and provide the patient with a survey at discharge to determine if music therapy or guided imagery provided from their computer or television aided in their pain management. Unfortunately, because the topic of non-pharmacological interventions is a considerably new topic, there are not many research articles available focusing on surgical patients. Researchers are facing some barriers, such as lack of sample sizes and time barriers. Articles are concluding that there are improvements with pain related to non-pharmacological interventions such as music therapy and guided imagery, but there is no significance. The lack of significance is what makes the conclusion that there is not enough information regarding the topic to make a change. As the years go on and holistic medicine is becoming more and more popular, I hope to find more research articles on this topic to present to my unit to implement change to improve pain management without using opioid medications. Until that time, this concludes the end of my project. Thank you.